Gastrointestinal bleeding. GI bleeding is not just a gastroduodenal disorder but may occur anywhere along the alimentary tract. Bleeding is a symptom of an upper or lower GI disorder. It may be obvious in emesis or stool, or it may be occult, that is hidden. Pathophysiology and etiology. Trauma, first one, trauma anywhere along the GI tract. Second, erosions or ulcers. Third, rupture of an enlarged vein such as a varicosity, esophageal or gastric varicosis. Fourth, inflammation such as esophagitis caused by acid or bile, gastritis, inflammatory bowel disease, chronic ulcerative colitis, Crohn's disease, and bacterial infection. Fifth, alcohol and drugs. Aspirin containing compounds, NSAIDs, that is non-steroidal anti-inflammatory drugs, anticoagulants, and corticosteroids. Sixth, diverticular disease. 7. Cancers. 8. Vascular lesions or disorders such as bowel ischemia, orthoenteric fistula. 9th, Mallory Weiss tear. Mallory, Mallory Weiss, Weiss. Mallory Weiss tear. 10th, anal disorders such as hemorrhoids or fissure. Clinical manifestations. Characteristics of blood. First one, bright red, vomited from high in esophagus, hematemesis. From rectum or distal colon, coating stool. Second, mixed with dark red, higher up in colon and small intestine mixed with stool. Third, shades of black, coffee ground in esophagus, stomach and duodenum, vomitus from these areas. Fourth, tarry stool, melena, occurs in patients who accumulates excessive blood in the stomach. Signs and symptoms of bleeding. First one, massive bleeding. Active bright red hematemesis or large amount of melena with clots in the stool. Rapid pulse, drop in blood pressure, hypovolemia and shock. Second, subacute bleeding. Intermittent melena or coffee ground emesis. Hypotension, weakness, dizziness. Third, chronic bleeding. Intermittent appearance of blood, increased weakness, paleness or shortness of breath and occult blood. Diagnostic evaluation. It is not difficult to diagnose bleeding, but it may be difficult to locate the source of bleeding. History, change in bowel pattern, presence of pain or tenderness, recent intake of food and what kind. Example, red beet. Alcohol consumption, drugs such as aspirin or steroids. Third, complete blood count, hemoglobin, hematocrit, platelets and coagulation studies, PT, PTT, INR may show abnormalities. Fourth, endoscopy, identifies source of bleeding, determines risk of rebleeding and provides endoscopic therapy if needed. Fifth, imaging may detect etiology of bleeding. Sixth, test of stool for occult blood. Management based on etiology. If aspirin or NSAIDs are the cause, discontinue medication and treat bleeding. If ulcer is the cause, medications, dietary and lifestyle modifications. Therapeutic endoscopic procedure, cautery injection. Fourth, surgery may be indicated for cancers, inflammatory disease and vascular disorders. Emergency intervention. Patient remains on NPO status. IV lines and oxygen therapy initiated. If life-threatening bleeding occurs, treat shock, administer blood replacements, intra-arterial vasopressin or embolization. Fourth, surgical therapy if indicated. Nasogastric intubation. An NG tube should be in place for most patients with acute or upper GI bleeding. If the aspirate continues to be bloody after 2 to 3 liters of tap water lavage, the patient may have an active bleed requiring more emergent intervention or endoscopic therapy. Other measures electrocoagulation using a heater probe, injection of sclerosant or epinephrine. The alert must be taken because the action of topical thrombin, it is used only on the surface of bleeding tissue and never is injected into the blood vessel where intravascular clotting may occur. Other measures include endoscopy with a conjunction with management measures as well as diagnostic evaluation. Fourth, pharmacotherapy depends on cause, can include histamine blockers are either continuous IV preferred or bolus infusion to block the acid secreting action of histamine. Intra-arterial vasopressin can be used to slow or stop active bleeding from diverticulum or vascular ectasia. Surgery is indicated when more conservative measures fail. Complications: hemorrhage, shock, death. Thank you.